Good day. I'm Rosalie Custodio, your teacher in grade 9 science. I'm here to tackle a new lesson. Did you know our topic for today is very important? Last week, you learned about the function of each part of respiratory and circulatory system. Today, you will learn more about the lesson. Are you ready? Let's get started. Week 2. How one's lifestyle affect the functioning of respiratory and circulatory systems. You will find out in this lesson the negative effects of cigarette smoking, how it damages the respiratory system and other parts. Long-term use or exposure to cigarettes increases the risk of acquiring respiratory-related diseases. You will be able to compare a healthy lung from unhealthy lung of a smoker. You will be determining different kinds of diseases and their underlying symptoms that affect the respiratory system and circulatory system. The respiratory system supplies the blood with oxygen in order for the blood to deliver oxygen to all parts of the body. The circulatory system transports blood and oxygen from the lungs to tissues in the body. How the systems work together. The circulatory and the respiratory systems work together to circulate blood and oxygen throughout the body. Circulatory system works very closely with the respiratory system to provide body cells with needed oxygen and to remove carbon dioxide waste. Oxygen taken in from the respiratory system moves into blood vessels, then circulate rich blood to tissues and cells. The respiratory system and the circulatory systems are functional in exchange of gases. It cannot work alone and function properly, which are truly dependent on each other. The benefit of one system is beneficial to the other, and the danger of one system is a danger to the other. A healthy lifestyle is essential in managing and taking care of the respiratory system, improvement of health and well-being of a person. Another risk factor that drastically increases heart rate and decreases the amount of oxygen in the blood is smoking cigarette. Smoking is dangerous to one's health, which is the leading cause of death and illness in public health worldwide. Form the simple activity to learn more about the negative effects of cigarettes on a person's circulatory and respiratory system. How does smoking affect the lungs? Which picture shows the healthy lungs of a non-smoker and which show the unhealthy lungs of a smoker? The first one or the second one? Compare the illustrations of healthy from unhealthy lungs of a smoker. Good job! This is the healthy lungs and this one is the smoker's lungs. As you notice, healthy lungs are light pink, while a smoker's lungs appear dark and mottled due to inhaled tar. The texture of the two also differs, with damaged lungs being a much harder and more brittle. Now, why is respiratory systems that works properly essential for a good health? The respiratory system provides the body with the oxygen it needs for respiration. Lungs are delicate, spongy organs that deal with 12,000 liters of air each day. Smoking is a very dangerous habit that has serious effects on the lungs and respiratory system. Now, how does smoking damage health and fitness? Lifestyle is a way of living that includes the habit, behavior, and living style condition of a person. There are lifestyle conditions of an individual that can be harmful to health and can cause illness, like cigarette smoking and drinking alcohol. Smoking has a negative impact on the environment, and when the air becomes polluted, it might cause serious health conditions. Cigarette smoking relates to many diseases that affect the respiratory system and other systems in the body. A cigarette is a thin cylinder containing cut tobacco leaves, chemicals, and substances rolled in paper for smoking. The chemical and substances present in cigarette cause harm and danger to the health and weaken the immune system. The common symptom present in respiratory diseases is a cough that clears the throat from irritants. Once regarded as socially acceptable, smoking is now counted among those habits which are hazardous to life. The worst part of smoking is that it not only causes harm to the smoker's health, but also to the surrounding people through passive smoking, which means to inhale cigarette smoke present in the environment and is equally harmful. Due to this reason, smoking is highly condemned. Now, there are more than 4,000 identified chemicals found in cigarette smoke, which have various carcinogenic and mutagenic effects. The three most health-damaging chemicals in tobacco smoke are nicotine, tar, and carbon monoxide. Now this time, let's find out the harmful chemicals that are found in cigarettes and its effects. First is arsenic. Arsenic is used as rat poison. Ammonia is used as floor cleaner. Butane is used in gas lighters. Carbon monoxide reduces oxygen availability. Formaldehyde used as preserving fluid. Nicotine is very addictive, and tar coats lungs like it does roads. Smoking and exposure to smoke is one cause of death and disease in the Philippines. Long-term smoking may lead to factors that affect the well-being of a person. It damages the air sacs in the lungs, weakens the immune system to fight infection and other diseases, and present chemicals and substances that are toxic in the body. Smoke exposure emitted by cigarette is deadly to the health of smokers and non-smokers. Non-smokers are at great risk of exposure to secondhand smoke from inhaled chemicals and substances in the cigarettes. Now, how does smoking affect the health? Here's the effects of smoking on health. Bronchitis, stomach cancer, lung cancer, liver cancer, leukemia, throat cancer, dental hygiene problems, emphysema, sperm abnormalities and impotence, menstrual problems, impaired immune system, cervical cancer, heart disease, kidney cancer, facial wrinkles, and bladder cancer. So now let us discuss the negative effects of smoking. Warning: cigarettes cause fatal lung disease. Number 1. Cigarettes contain chemicals and substances that can be toxic in the body. Tar is a brown sticky substance that consists of tiny particles and is formed when tobacco smoke condenses. It is deposited in the lungs and coats the surface of the alveoli. Nicotine is an addictive drug that affects the central nervous system. It increases the heart rate and narrows the blood vessels, causing high blood pressure. Smoking can cause serious problems to the respiratory system and different parts of the body. Again, tar is a toxic chemical which contains carcinogen that can cause cancer, and nicotine is a chemical stimulant that can be addictive. Number 2. Cigarette smoking produces carbon monoxide, which is a gas produced when smoking in an enclosed space. Carbon monoxide poisoning is caused by a large number of smoked cigarettes that lowers the percentage of oxygen and replaced by a high percentage of carbon monoxide in the bloodstream. Carbon monoxide is a poisonous gas that reduces the amount of oxygen that red blood cells carry around the body. Number 3. Exposure to dust, pollens, and smoke can trigger allergic reactions that cause breathing difficulties. Asthma is an inflammation and narrowing of airways, making it hard to breathe. The common symptoms of asthma are cough, shortness of breath, wheezing, and tightness of the chest. Number 4 is smoking can cause lung disease that damages the airways, air sacs, alveoli, in the lungs. Emphysema is a known cause of the chronic obstructive pulmonary disease or COPD that cause long-term breathing problems and poor flow of air that worsen in time. The common symptoms of emphysema are difficulty in breathing, wheezing, and chest pain. When the air sacs in the lungs are broken down by the harmful chemicals in the tobacco smoke, the surface area for the exchange of gases in and out of the body is reduced. More air has to move out in and out of the lungs. This increases the rate of breathing, making breathing more painful. Emphysema prevents its sufferer from being active. Number 5. Smoking can cause irritation, inflammation, and swelling of the bronchial tubes called bronchitis. Some of the significant symptoms of bronchitis are cough with clear yellow or green mucus or sputum, shortness of breath, and wheezing. There are 2 types of bronchitis. Acute bronchitis is a common type of bronchitis symptoms, lasts for a few weeks, and chronic bronchitis is a more serious type of bronchitis which symptoms last and comes back. Tar accumulates in the lungs during smoking and paralyze the cilia. Due to paralysis, cilia cannot remove dust particles, allowing dust and germs to enter the lungs. Hence, the smoker coughs persistently. This type of cough is called a smoker's cough. The air passages may become inflamed and the person suffers from bronchitis. A person suffering from bronchitis becomes easily breathless and may not be able to walk properly or sleep. Chronic bronchitis can be fatal. Number 6. Smoking can weaken your immune system against bacteria and viruses by damaging your body's natural defense. Pneumonia is a type of lung infection that causes the air sacs filled with fluid or pus, which cause breathing difficulties. The age groups at risk in pneumonia are ages 0 to 2 and 65 years old and above due to immune system strength. Other symptoms are chest pain, cough with mucus or phlegm, fatigue, and loss of appetite. Number 7. Cigarette smoking causes most cases of cancer. Lung cancer is the most typical kind of cancer and reason behind death. It is caused by abnormal growth of cells in the lung or lung tissues. The most common symptoms are long duration of cough, coughing up blood, chest pain, loss of weight, and shortness of breath. It is very common among cigarette smokers. Tar contains many carcinogenic chemicals like benzopyrene, which cause cancer. If the outgrowth or tumor obstructs the air passages, it can result in death. Number 8. Tuberculosis is an infectious disease that can be transmitted through air droplets that spread from one person to another person, like coughing, sneezing, talking, and laughing. The disease is caused by a bacterium called Mycobacterium tuberculosis, which attacks the lungs and can spread into the different parts of the body. Usual symptoms are a cough that lasts for 3 weeks, chest pain, coughing with blood-streaked sputum or phlegm, night sweat, and weight loss. Warning: cigarettes cause strokes and heart disease. Number 9. Cardiovascular diseases affect the heart and blood vessels. That includes atherosclerosis, coronary thrombosis, high blood pressure, heart attack, and stroke. Blood pressure. Tobacco consists of carbon monoxide and nicotine, which contributes greatly to heart attack. Carbon monoxide reacts with hemoglobin to form carboxyhemoglobin. It cannot be broken up easily and reduces their blood carrying capacity. The heart has to pump faster in order to maintain a normal blood flow, thus increasing the blood pressure. Heart attack. Carbon dioxide and nicotine increases the rate at which the fatty material is deposited in the arteries, which constrict them. Narrowed arteries supply insufficient blood to heart muscles, leading to angina pains. If these fatty deposits completely block an important artery such as coronary artery, it can lead to heart attack. Next is stroke. People who smoke cigarettes are also at a great risk of stroke. The carbon monoxide that lives in cigarette smoke has been associated with hardening of arteries, which can lead to stroke caused by blood clots in the brain. Nicotine in cigarettes also causes the arteries in the legs and arms to tighten, which increases a risk of blood clots and damaged arteries surrounding the heart. And number 10, smoking relates to death and risk in health conditions. Smoking affects the respiratory and the circulatory system, but has many other effects on the body. Cardiovascular diseases affect the heart and blood vessels. Respiratory diseases affect the lungs by damaging the airways and alveoli, and cancer caused in any part of the body. Now, what other health problems and diseases are related to this habit? So in the illustration, it shows the risk from smoking. So it can cause cancers, like cancer in the head, lung, leukemia, stomach, kidney, pancreas, colon, bladder, cervix. And chronic diseases like stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease, and asthma, reduced fertility, and hip fracture. Let's remember, cigarettes have chemicals and substances that contain nicotine, tar, and increases the level of carbon monoxide that can poison the blood. Number 2, non-smokers are at risk of exposure to secondhand smoke from inhaled chemicals in the cigarette. Secondhand smoke is a type of smoke coming from the person smoking. Number 3, lung cancer is the most common type of cancer. It is caused by abnormal growth of cells in the lung tissues. Number 4, lung cancer and tuberculosis have the symptoms of cough, blood-streaked sputum when coughing, chest pain, and weight loss. And number 5, smoking can cause different diseases in the respiratory tract such as asthma, bronchitis, emphysema, pneumonia, lung cancer, and tuberculosis. Remember, cigarette smoking harms nearly every organ in the body, causing many illnesses and affecting the health in general. The negative effects of smoking on the circulatory system also includes heart disease, arteriosclerosis, and vascular diseases. Now, the best way to prevent diseases in the respiratory and circulatory systems is to have a healthy lifestyle. Let's apply. Write your answers on a sheet of paper. Number 1, why is it important to have a healthy lungs? Number 2, enumerate 5 ways on how to take care of your lungs and live a healthy life. And number 3, do you have a relative or a friend who smokes? What advice can you give them to eliminate their habit in smoking? That's the end of our lesson for today. Watch out for the next topic of Grade 9 Science lesson. Read your modules and answer the questions appropriately. Once again, this has been your teacher, Rosalie Custodio, saying, learning science is fun, cool, and awesome. Till next time, learners, have a nice day!